16 mistakes hypertensive patients should not make. Did you know that high blood pressure is one of the greatest health risks in the modern world? Often called the silent killer, it can develop without apparent symptoms but can lead to devastating consequences such as heart attacks and strokes. According to the World Health Organization, 1 in 4 people worldwide suffers from hypertension, and most of them are unaware of the daily mistakes they make, putting their lives at risk. What are the 16 most common mistakes that hypertensive people make? What foods should be avoided and which ones are recommended to help control blood pressure? And what are the 6 essential tips to effectively lower blood pressure? In this video, we will explore all of this in detail, offering valuable and practical information that can make a big difference in your health. Stay with us until the end to learn how you can improve your quality of life and keep your blood pressure under control with some simple and effective changes to your daily routine. 16 mistakes hypertensive patients should not make. Mistake 1. Excessive salt intake. Sodium is one of the main culprits of high blood pressure. Excessive salt intake can cause fluid retention, which increases blood volume and, consequently, pressure in the arteries. The recommendation is not to exceed 5 grams of salt per day, equivalent to a teaspoon. Prefer natural seasonings such as herbs and spices to flavor foods. Many processed foods contain significant amounts of hidden salt, so reading food labels can be a powerful tool to reduce sodium intake. Additionally, opting for fresh foods and preparing meals at home can help control the amount of salt consumed. Mistake 2. Sedentary lifestyle. Lack of physical activity is detrimental to cardiovascular health. Regular exercise helps strengthen the heart and improve blood circulation, reducing blood pressure. Try to incorporate at least 30 minutes of moderate physical activity, such as walking or cycling, into your daily routine. Besides helping control blood pressure, regular exercise can improve mental health, increase energy, and promote better sleep. Find an activity you enjoy, whether it's dancing, swimming, or even gardening, and make it part of your daily life. Mistake 3. Not following medical treatment properly. Many hypertensive people stop taking medication without medical guidance, which can be dangerous. It is crucial to follow your doctor's prescriptions and never stop taking medications on your own. Keeping open communication with your doctor helps adjust the treatment as needed. Some people may feel fine and decide to stop the medication, but this can lead to dangerous blood pressure spikes. Always discuss any changes in treatment with your doctor and don't hesitate to talk about side effects or concerns you may have. Mistake 4. Diet high in saturated fats. Diets high in saturated fats can increase cholesterol levels and lead to plaque buildup in the arteries, raising blood pressure. Opt for healthy fats found in foods like avocados, nuts, and olive oil. Avoid processed foods and fried foods. Replacing saturated fats with unsaturated fats can significantly impact cardiovascular health. For example, substituting butter with olive oil or choosing lean cuts of meat can help reduce saturated fat intake. Mistake 5. Stress and lack of emotional control. Chronic stress can cause blood pressure spikes. It's important to find ways to manage stress, such as practicing meditation, yoga, or other relaxation techniques. Maintaining healthy emotional balance is also crucial for heart health. Stress can lead to unhealthy behaviors such as overeating, smoking, or excessive drinking. Learning to recognize the signs of stress and developing healthy strategies to cope with it can significantly improve overall health. Mistake 6. Excessive alcohol consumption. Alcohol can raise blood pressure, especially when consumed in large quantities. Limit consumption to 1 drink per day for women and 2 for men. Choose low-alcohol beverages and avoid frequent consumption. In addition to raising blood pressure, excessive alcohol consumption can contribute to weight gain, liver problems, and increase the risk of other health conditions. Drinking in moderation and opting for non-alcoholic alternatives can be a good strategy to control blood pressure. Mistake 7. Lack of home blood pressure monitoring. Monitoring blood pressure at home can help identify fluctuations and adjust treatment as necessary. Use a reliable blood pressure device and keep a record of the measurements to discuss with your doctor. Measuring blood pressure at home can provide a more complete picture of your health, especially since blood pressure can vary throughout the day. This can also help identify white coat hypertension, where blood pressure rises in a clinical setting due to anxiety. Mistake 8. Smoking. Smoking is extremely harmful to cardiovascular health. It causes the narrowing of the arteries and increases blood pressure. Quitting smoking is one of the best things you can do for your health. Seek medical help if necessary to kick the habit. Smoking not only affects blood pressure but also damages blood vessels and reduces oxygen levels in the blood. There are many options available to help quit smoking, including nicotine replacement therapy, medications, and counseling. Mistake 9. Excess caffeine. Caffeine can cause a temporary increase in blood pressure. Limit consumption of coffee, tea, and energy drinks. Prefer decaffeinated beverages or alternatives like herbal tea. Although some people may be more sensitive to caffeine than others, it's a good idea to monitor how caffeine affects your blood pressure and adjust consumption accordingly. Drinking water and caffeine-free teas can help maintain hydration without raising blood pressure. Mistake 10. Poor sleep. Sleep quality is fundamental to overall health, including blood pressure. Sleep disorders like apnea can raise blood pressure. Maintain a regular sleep routine and create a conducive environment for rest. Lack of sleep can increase stress levels and contribute to unhealthy behaviors like poor diet and lack of exercise. Prioritizing sleep and treating any sleep disorders can positively impact cardiovascular health. Mistake 11. Not consuming enough fruits and vegetables. Fruits and vegetables are rich in essential nutrients and potassium, which help control blood pressure. Include a variety of colors and types in your daily diet to ensure balanced nutrition. Fruits and vegetables are also an excellent source of fiber, which can help control cholesterol levels and promote healthy digestion. Try to include fruits and vegetables in all meals and snacks. Mistake 12. Neglecting routine checkups. Regular doctor's visits are essential to monitor cardiovascular health and adjust treatment as needed. Don't skip routine checkups and follow your doctor's recommendations. Routine exams can detect health problems in their early stages, when they are easier to treat. Maintaining an open relationship with your doctor and following their guidance can help prevent complications. Mistake 13. Self-medication. Taking medication without medical guidance can be dangerous and ineffective. Always consult a healthcare professional before starting or changing any medication. Self-medication can lead to dangerous drug interactions and mask symptoms of underlying health problems. Always seek medical guidance before taking any new medication or supplement. Mistake 14. Ignoring warning symptoms. Symptoms like severe headache, blurred vision, and shortness of breath can indicate serious blood pressure problems. Do not ignore these symptoms and seek immediate medical attention if necessary. Recognizing and responding quickly to warning symptoms can prevent severe complications like heart attacks and strokes. If you have any doubts about any symptom, do not hesitate to seek medical help. Mistake 15. Lack of adequate hydration. Dehydration can negatively affect blood pressure. Drink water regularly throughout the day and avoid sugary or high-sodium beverages. Proper hydration is essential for the functioning of all body systems, including the cardiovascular system. Staying hydrated can help maintain blood pressure at healthy levels and improve overall health. Mistake 16. Unregulated social life. Excessive partying, clubbing, and sleepless nights can harm cardiovascular health. Maintain a healthy balance between social life and rest, and avoid excesses that can negatively impact your blood pressure. Maintaining a regular sleep routine and limiting alcohol and unhealthy food consumption at social events can help control blood pressure and promote a healthier lifestyle. 5 foods that a hypertensive person should never eat. 1. Table salt. Sodium is one of the main culprits of high blood pressure. Reduce the use of salt in food preparation and avoid processed foods rich in sodium. Foods like potato chips, canned soups, and ready-made condiments often contain large amounts of sodium. Opt for preparing meals at home with fresh ingredients and natural seasonings. 2. Canned foods. Most canned foods contain high levels of sodium as a preservative. Always prefer fresh or frozen options without added salt. Canned products like beans, vegetables, and soups can be purchased in low sodium or no added salt versions. Rinse canned foods well before use to remove some of the sodium. 3. Processed meats. Sausages, bacon, and other deli meats are rich in sodium and saturated fats, which can increase blood pressure and the risk of cardiovascular diseases. Opt for fresh and lean meats such as chicken, fish, and lean cuts of beef to help reduce sodium and saturated fat intake. 4. Fast food. Fast food is generally high in sodium, fats, and calories, which can lead to increased blood pressure. Avoid or limit the consumption of these foods. When eating out, choose healthier options like salads with dressings on the side, non-fried sandwiches, and grilled instead of fried foods. Reading the nutritional information on fast food menus can help make healthier choices. 5. Soda and sugary drinks. These beverages contain large amounts of sugar and sodium, contributing to increased blood pressure and weight gain. Prefer water, natural teas, or unsweetened juices. Besides increasing blood pressure, excessive sugar consumption can lead to insulin resistance and increase the risk of type 2 diabetes. Reducing the consumption of sugary drinks can help control blood pressure and improve overall health. 5 foods that a hypertensive person should eat. 1. Bananas. Rich in potassium, bananas help neutralize the effects of sodium and lower blood pressure. Include a banana in your breakfast or as a snack. Potassium is an essential mineral that helps regulate fluid balance in the body and muscle function. Eating a banana a day can provide a good amount of potassium and help keep blood pressure under control. 2. Spinach. This dark green vegetable is rich in potassium, magnesium, and fiber, nutrients that help control blood pressure. Add spinach to salads, soups, and juices. Besides helping to control blood pressure, spinach is an excellent source of vitamins A and C, which are important for overall health. Try adding spinach to smoothies or sautéing it with garlic and olive oil as a healthy side dish. 3. Oatmeal. Rich in fiber, oatmeal can help lower blood pressure and cholesterol. Start the day with a healthy oatmeal porridge. The soluble fiber in oatmeal, known as beta-glucan, helps reduce blood cholesterol levels and can have a positive effect on blood pressure. Add fresh fruits, nuts, and seeds to oatmeal for a nutritious and tasty breakfast. 4. Salmon. A source of omega-3 fatty acids, salmon helps reduce inflammation and blood pressure. Include fish in your diet at least twice a week. The omega-3 fatty acids in salmon can help reduce inflammation, improve heart health, and lower blood pressure. Other good sources of omega-3 include sardines, herring, and tuna. Try grilling salmon and serving it with a spinach salad for a healthy and delicious meal. 5. Natural yogurt. Rich in calcium and probiotics, natural yogurt helps keep blood pressure under control. Prefer versions without added sugar and add fresh fruits for flavor. Calcium is essential for muscle function and bone health, and probiotics in yogurt can help maintain a healthy digestive system. Try adding berries and a bit of honey to natural yogurt for a healthy and tasty snack. 6 tips to lower blood pressure. Tip 1. Exercise regularly. Regular exercise is one of the most effective ways to control blood pressure. Activities like walking, running, swimming, and cycling strengthen the heart and improve circulation. Try to incorporate at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous activity per week. Additionally, strength exercises twice a week are also recommended. Exercise not only helps control blood pressure, but also improves mental health, promotes weight loss, and increases energy. Find an activity you enjoy and make it part of your daily routine. Tip 2. Adopt a balanced diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can help control blood pressure. The DSH, Dietary Approaches to Stop Hypertension, eating plan is highly recommended. It emphasizes the consumption of foods rich in potassium, calcium, and magnesium, which help lower blood pressure. Avoid processed and sugary foods. Adopting a balanced diet not only helps control blood pressure, but also improves overall health and reduces the risk of other chronic diseases. Try new recipes and foods to make healthy eating enjoyable and diverse. Tip 3. Reduce salt intake. Reducing salt in your diet can significantly impact blood pressure. Replace salt with herbs and spices to flavor foods. Read food labels to avoid high sodium products and cook more at home to control the amount of salt in your dishes. Reducing salt intake can be challenging at first, but over time, your taste buds will adjust, and you'll learn to appreciate the natural flavor of foods. Try using garlic, onion, lemon, and other herbs and spices to add flavor without adding sodium. Tip 4. Manage stress. Relaxation techniques like meditation, deep breathing, yoga, and mindfulness can help reduce stress and consequently blood pressure. Find activities you enjoy that help you relax, such as hobbies, reading, or nature walks. Maintaining a positive mindset and practicing gratitude are also effective ways to manage stress. Chronic stress can lead to unhealthy behaviors such as overeating, smoking, or excessive drinking. Developing a daily relaxation and self-care routine can help keep stress under control and improve overall health. Tip 5. Quit smoking. Quitting smoking has immediate and long-term benefits for blood pressure and overall health. Smoking damages the arteries and increases the risk of cardiovascular diseases. Seek smoking cessation programs, support groups, and if necessary, medications prescribed by a doctor to help you quit. Quitting smoking is one of the best things you can do for your health. The benefits begin to be felt almost immediately after quitting, including improved circulation and lung function. There are many resources available to help quit smoking, including nicotine replacement therapy, medications, and counseling. Tip 6. Monitor blood pressure regularly. Measuring blood pressure regularly at home can help track how your body responds to treatment and lifestyle changes. Use an approved blood pressure monitor and follow the instructions for accurate measurements. Record your readings and share them with your doctor for treatment adjustments if necessary. Monitoring blood pressure at home can provide a more complete picture of your health and help identify patterns or fluctuations that may not be visible during medical appointments. This can also help increase treatment adherence and promote greater health awareness. Share this content with friends and family who can also benefit from this information. Taking care of your health is an act of self-love. Thank you very much for watching, and see you in the next video.